What if I told you that some of the symptoms you've been brushing off, like being super thirsty or always tired, could actually be signs of something much more serious? Something you might not even realize you're at risk for diabetes. Yes, diabetes. It doesn't always look the way you expect. In fact, some of the most common signs can sneak up on you and leave you wondering if you've just been too stressed or out of shape. But here's the thing. The sooner you spot these symptoms, the sooner you can take control of your health. Let's break down some unexpected symptoms of diabetes that you should never ignore. 1. Unexpected weight loss. First up, unexpected weight loss. Wait, what? Isn't diabetes usually associated with weight gain? Well, yes, but diabetes, particularly type 1 diabetes, can actually cause weight loss even if you're eating the same amount or more than usual. Here's why. When your body can't use sugar properly because of insulin resistance or insufficient insulin, it starts breaking down fat and muscle for energy instead. So even though you're eating, your body isn't able to absorb the nutrients the way it should. And you might see the scale dropping, not going up. It's like putting fuel in your car, but the engine isn't working right, so the fuel doesn't get used as efficiently. What to watch for? Sudden and unexplained weight loss. Feeling hungry all the time, but losing weight nonetheless. Lack of energy despite eating regularly. What to do? If you're noticing weight loss without change in your eating habits, it might be worth talking to a doctor. It could be something else, but it's a red flag for diabetes that shouldn't be ignored. Keep track of your weight over time, and make a note if it's dropping without a clear cause. 2. Constant fatigue. Next, let's talk about fatigue, feeling drained all the time, even after a full night's sleep. If you're always tired, no matter how much rest you get, your blood sugar might be out of whack. When your body isn't using glucose properly due to insulin resistance, your cells don't get the energy they need. That means you feel sluggish, foggy, and like you're carrying a mental and physical weight. It's like trying to run a race while dragging a heavy backpack. What to watch for? Constant tiredness, even after a full night of sleep. Struggling to focus or stay alert, even when you're well rested. A feeling of being burnt out with little motivation to do anything. What to do? If fatigue is a constant battle for you, get checked for blood sugar issues. It might not be just a sign of stress or burnout, it could be a warning sign of diabetes. Make sure you're eating balanced meals and staying hydrated, but if the fatigue persists, talk to your healthcare provider. 3. Excessive thirst and urination. Now, let's talk about thirst and frequent urination, classic signs of diabetes, but here's the twist. These symptoms often creep up slowly, and many people chalk them up to a busy lifestyle or just being dehydrated. When your blood sugar levels are too high, your kidneys work overtime to filter the excess sugar out of your blood. This leads to frequent urination and your body losing fluids, which makes you feel thirstier than usual. It's like your body is flushing out water while desperately trying to replenish itself, but it never quite feels satisfied. What to watch for? Constant thirst, even after drinking a lot of water. Waking up multiple times at night to use the bathroom. Peeing more often than usual throughout the day. What to do? If you find yourself constantly reaching for water and heading to the bathroom more than normal, it might be a sign that your blood sugar levels need checking. Don't ignore it, especially if these symptoms are happening more often. Talk to your doctor for a blood test and check your blood glucose levels. 4. Blurred vision. Here's another unexpected one. Blurred vision. High blood sugar levels can cause fluid to be pulled from tissues in your body, including your eyes. This affects the lens and can lead to blurry vision. It's like trying to look through fogged-up glasses. Your eyes can't focus properly. The worst part? It can happen so gradually that you don't even notice it at first. You might think it's just a sign you need glasses or that your vision is getting worse with age, but it could be more than that. What to watch for? Blurred or double vision. Difficulty focusing, even when wearing corrective lenses. Seeing spots or floaters in your vision. What to do? If you notice your vision changing, get an eye exam. It could be related to diabetes, and the sooner you address it, the less chance there is of permanent damage. High blood sugar can lead to diabetic retinopathy, a condition that can severely affect your vision, so catching it early is crucial. 5. Numbness or tingling in hands and feet. Numbness or tingling in hands and thighs. Numbness or tingling in hands and feet. Now, let's talk about that weird sensation you sometimes get in your hands and feet, numbness or tingling. This is a neuropathy symptom, which happens when high blood sugar levels damage the nerves over time. It can feel like pins and needles, or you might just feel numb or disconnected in your limbs. This is one of those symptoms that sneaks up on you and can get worse without you noticing. What to watch for? Tingling, numbness, or a pins and needles feeling in your hands, feet, or legs. Weakness or difficulty with movement in your limbs. Sensitivity to touch or temperature changes. What to do? If these sensations are happening regularly, especially in combination with other symptoms, talk to your doctor about getting your blood sugar levels checked. Diabetic neuropathy can be prevented or managed if caught early, so don't wait too long. 6. Slow healing of cuts and wounds. If you're finding that cuts and bruises take forever to heal, this could be another sign of diabetes. High blood sugar levels can affect circulation and your body's ability to heal properly. It's like having a slow-moving repair crew, where the workers just don't show up on time. This can be particularly noticeable if small injuries like paper cuts or scrapes seem to take weeks instead of days to heal. Over time, poor circulation caused by high blood sugar can also lead to infections. What to watch for? Cuts or wounds that take longer to heal than usual. Recurring infections in the skin or gums. Frequent skin irritation or dryness. What to do? If you're dealing with slow healing injuries, and especially if it's combined with other symptoms, get checked for diabetes. Early intervention is key to preventing complications. Keeping your blood sugar levels under control can help improve your body's ability to heal and avoid infections. So, there you have it, the unexpected symptoms of diabetes that could be hiding in plain sight. If you're experiencing any of these, don't just brush them off as normal aging or stress. Diabetes can creep up on you. But the sooner you recognize the signs, the sooner you can take action to protect your health. Remember, diabetes doesn't always show up the way you think it will. If you're unsure, don't wait, talk to your healthcare provider and get your blood sugar levels checked. If you found this video helpful, make sure to like, comment, and subscribe for more health tips and awareness. Your health matters, and it's never too early to take control.